Okay, I see that we're now officially live on Facebook. I'd like to welcome everybody to the Calhoun County Joint Information Center briefing for Wednesday, October 28th, 2020. Some administrative notes, please mute your phone if you haven't already. And if you do have questions during today's presentation, you can go to the chat function, and Jessica is going to be on board with following up on your questions. Next page, please. Unified Command Team, Kelly Scott, Ted Deering in for Rebecca Fleury, and Eric Pessel. Next slide, please. Your additional speakers for today. Next slide, please. Joint Operations Center lines of effort and priorities. And next slide, please. The purpose of Joint Information Center, or the JIC. Next slide, please. Moving into our agenda, we'll get started today with the current situation and Eric Pessel. Eric?
Thank you, Dirk. I wanted to draw everybody's attention. This is a slide we put up 14 days ago. It was our current situation back on October 14th, and I just want to point out the number. At that point, we were reporting 1,754 cases, 134 total hospitalizations, 24 were currently in the hospital, and we had 48 deaths. Could you go to the next slide, please? This is our current situation as of 14 days later today. We're at 2,631 cases. It's about, I think it was around 900 additional in 14 days, up to 171 total accumulated hospitalizations. We currently have a census of 35 in our 2 county hospitals, and our deaths have gone up to 66. So, I wanted to put both of these slides on there just from the standpoint of a lot has changed in the last 2 weeks. We told you about a surge 2 weeks ago. Now, my comment is I would not consider this any longer a surge. This is an unprecedented spread of the virus in our community. It's a curve, as you can see on the right-hand side of the graph, that we need to figure out a way to bend back down. And hopefully after today's update, those of you leaders in the community will be able to take our message out to the community and spread the word that we need to do everything possible to stop transmitting the virus, which includes wearing a mask, staying socially distant, and stop gathering in large groups or even small groups indoors if at all possible. Next slide. So a little bit about what we're seeing in our current hospitalizations. Hospitals are also seeing a surge in cases. They're also seeing a higher number of just people that are non-COVID that are in the hospital. We have to remember that not every person in the hospital is a COVID patient, and therefore there's a balance between how many people are in the hospital non-COVID versus how many are COVID. And yet we're seeing a surge of COVID cases as well. We have seen, as I pointed out, the unprecedented number of deaths in the past 2 weeks, but actually in the last, I think it was last Monday, we reported 50. And as of today, as I said, we had 66. That's an unprecedented number. We are continuing, Dr. Nettleton and myself and staff are continuing to converse with our local hospitals, with Bronson Battle Creek, Oak Lawn, Borges Ascension, and we will continue those discussions and conversations to stay up to date on the latest information that the hospitals are giving us. But I want to point out, as the last bullet says there, this is a situation that is not sustainable. We cannot continue on a curve we are under. Next slide. Just a little bit of continuation to work with schools. There was a letter that went out from all of our county superintendents. You may have seen in the local publications a couple days ago or maybe late last week. that talked about, the schools wanting people to really work hard on following the basic principles, wear a mask, stay socially distant, try not to gather unnecessarily. Because obviously if the trajectory continues, the schools may need to make additional changes to their operation. Nobody wants that. We want our kids to have as much in-person instruction as possible. But like I said, this is an unsustainable curve that we're on right now. And it just cannot continue. So Dirk, before I end this, I want to turn it over to Dr. Nettleton. He wanted to give a few words about our current situation to this group. Doc?
Yes, thank you, Eric. Dirk, maybe you can go back a slide or two to the last curve.
Yes, we sure can. It's going to be like 3 slides, I believe.
Okay. So as he's kind of going back to that slide, I know there's been questions in the community about cases and kind of what all this means. And so I thought I'd just take a few moments and address some of those common questions, and also maybe close with an analogy, kind of where we are right now. So one question is, well, are these, quote, active or cumulative cases that Eric is characterizing right now? And so the best way to think about it is that these are new cases. You see those on the right side of the curve. And so people are generally infectious with COVID-19 without symptoms or with symptoms. And for those with symptoms, we typically think about a person being infectious 2 days prior to becoming symptomatic, and for up to 10 days after for most people who have mild to moderate COVID-19 disease. In some people, it can be longer than that. So these are new cases, and it's a dramatic increase, particularly over the last several weeks. And it's important to remember too that wide span of days that a person is actually infectious, and also to remember that people are infectious even without symptoms. So these are new cases. Another common question I think that comes up is, hey, well, aren't we doing increased testing? And wouldn't that explain this rise in cases? We are indeed testing more in Calhoun County as the rest of Michigan and the country is, but it does not alone explain what we are seeing. We are seeing an increase in the percent positivity, increase in hospitalizations, an increase in deaths as well. And that point that I just mentioned, the percent positivity, that data point is telling. That's the number of positives out of the total number that we are testing. So if there was less virus circulating in our community, well, then the percent positivity rate would be low too, but it is not. In fact, it is increasing. So there is more virus circulating in our community right now, and we are having widespread, uncontrolled community transmission of COVID-19. Another challenge is understanding what's the risk. What's the risk to me as a person, a risk to my family, the risk to our community. And it's hard to digest that when, again, this disease has such a wide presentation. We have most folks who have no symptoms. Most folks who, if they get symptoms, are mild. We have some folks with no symptoms at all. And then we have some folks that get really sick and wind up in the hospital. And we have a very small proportion of folks who die. So it's very hard to digest that risk. But I want to share, as I did 2 weeks ago, that those small percentages, when applied to our entire community, our entire population who is at risk for getting COVID-19, can result in those significant outcomes. And those significant outcomes include hospitalization and death. So for example, if we have 1,000 cases of COVID-19 and the death rate applied to our general non-age adjusted population is 0.5%, that equates to 5 of our community members dying. Okay. If the fatality rate is 1%, out of that 1,000 people who get COVID-19, that equates to 10 of our community members dying. So although those percentages sound small, when applied to our entire population, our entire community, it does result in significant outcomes, particularly when the outcome is hospitalization or death. And the last point is I hear folks saying, well, hospitalizations for COVID don't seem that high. What is the concern there? And it's important to remember, as Eric pointed out, that these hospitalizations are in addition to the other folks that we care for every day in the hospital. Every day we take care of folks who have heart attacks, who have heart failure, who have pneumonia, who have COPD exacerbations. Those are what I see regularly in the hospital. So these additional patients who have COVID-19 require additional planning and additional staff, and in addition to all of the other conditions that we take care of our community every day for. So I was driving into work today, and 30 miles an hour going down a 4-lane road, and 3 deer wandered across my path. There were people behind me, and there were people in oncoming traffic towards me. And I don't know those folks, so those are strangers to me. But I put on my hazard lights. I alerted the folks who were behind me and the folks that were coming towards me. And folks slowed down. Folks stopped, and the whole deer pack kind of went across the road. I find that analogous to where we are right now. Your public health professionals are communicating that there is a hazard, and we are putting on the hazard lights, and we're honking our horn. And we're not going 30 miles an hour right now, we're going 70 miles an hour. So I want our community to hear that message, that the trajectory that we are on does require changes in our behavior. We really have to wear our masks, physically distance more than 6 feet, avoid those social gatherings. And to be human is to be social, but this is how the virus spreads. And these are the tools we have in our toolbox right now to help reduce our spread. Thank you for allowing me to share these thoughts today.
Dr. Nelson, thank you very much. Appreciate that report, Eric Pessel, as well. Before we move on to the county jail outbreak and a report from Sheriff Hinckley, I want to remind everybody to check chat out because there's a lot of very good information going on there. And I appreciate the efforts of Jessica and Jill and the others that are jumping on there as we move forward. So thank you for that. Our next speaker is going to be Sheriff Steve Hinckley to discuss the jail outbreak. Sheriff.
Hi, good afternoon. I'll give you an update here at the corrections facility. So we're still at, as of yesterday, we're still at 24. 2 of those individuals have mild symptoms. They're currently in our medical area. The other 22 are asymptomatic with no symptoms. I will tell you that the correction staff, we made massive movements and changes so we could quarantine all of the asymptomatic individuals, and medical is handling all of that. We also have 2 additional asymptomatic, no symptoms in our intake quarantine area that have came into the jail. So we're seeing what's happening in the community, we're seeing here. And we are, that 24 person outbreak was restricted to 1 geographic location in the facility, which we were able to isolate, and we were able to work with the health department through that process. We, like all of you, are very flexible. We open the playbook every day. The next page we turn and it's blank, and we find ourselves, just like you, writing that playbook. So we are continuing to review. We're continuing to clean. We have an opportunity recently received from the state for some new 15-minute testing kits, possibly for our staff. So we are, every time we have a new science or new information, we take advantage of that and move forward. But I do want to say this with that update. I do want to say this. So our correctional staff now has taken on well, first and foremost, they've already taken on additional duties. Now they are actually doing laundry, meal transportation, and garbage service. So they're doing more and more things so we can get through this particular incident here in the facility. They're doing a fantastic job. And I want to end and say here, and I'll try to check the chat. I think most of the questions have been answered, but I'll check in just a second. I want to say a thank you to our healthcare here inside of our facility. And I want to make sure I say a thank you to both Bronson and Oaklawn for all of their work out in the community also. And I think one of the questions, do we test new individuals? Yeah, absolutely. So what we have been doing is we have a 14-day quarantine. When a police department brings an individual to the jail, that officer is not allowed inside the facility. We actually bring that individual in ourselves. That person is put into a 14-day quarantine area. He actually goes through an assessment process with our medical, and then we actually test that individual before that person comes out of the quarantine area and is placed into general population. So we are continuing to review all of those policies and procedures, and we're continuing to listen to everyone on how we can do things better. That is the end of my report. I think I caught it all.
Okay, very good. Thank you, Sheriff Hinckley, for that report. We're going to move down to one of our unified commanders and administrator controller for the Calhoun County, Kelly Scott, who will be covering workplace guidance and election reminders. Kelly?
Thank you, Dirk. One of the important conversations happening right now, both among county government leadership and honestly in my home environment, is that in addition to COVID fatigue, which we've talked about before, we also seem to have a false sense of comfort being around our friends and family without masks and without social distancing. So at home, my kids who are age 18 to 21, they seem to be proud of their behavior, describing that they feel comfortable having small get-togethers, not large gatherings, and only with their friends that they think are responsible and not reckless about COVID precautions. At work, it's kind of similar. It sounds like this. We know and we trust our coworkers. We see them every day. In fact, they're like family to us. So it's a lot easier when we're in small group meetings and in within our shared office spaces. It's hard to social distance. As Dr. Nettleton pointed out, it's not in our normal human behavior. We're social beings. It's also a lot easier to talk and to hear each other without masks on. Both of these situations have contributed to the surge in COVID cases that you heard about earlier. The county has seen our first instance of workplace-related exposure within the last few weeks, and I'm sure numerous other employers have as well. From the Joint Operations Center, we've focused many of our communications on the importance of individual behavior, which is important, and complying with the continued mask requirements, which you saw on chat are still in place. And then the gathering limits, the masks and the gathering limits, both are set forth by the MDHHS pandemic order issued earlier this month. So today I want to focus on instead of on individual responsibility, I want to focus on what responsibility all employers within the state of Michigan have to control, prevent, and mitigate the spread of coronavirus within our workplaces. So MIOSHA, Michigan Occupational Safety and Health Administration, issued emergency rules that took effect on October 14. They're in effect for 6 months, and they require every employer to establish exposure risk determination for employees. So actually look at each job category, each job duties, and figure out what risk level our employees are at, and so that we can respond appropriately. This emergency rules still require us to have COVID-19 preparedness and response plans that were previously required based on the governor's executive orders. So the county has updated our plan. The city of Battle Creek also has updated their plan, and they're very similar to what we already had in place. The main updates were there is now a record keeping requirement that we keep for 1 year all documents related to employee and visitor screening, training, and how we're reporting the COVID cases to the proper authorities. There's also a new requirement to actually have a policy that requires remote work when it's feasible. The county already had a temporary telecommuting policy in place, and that's on our website for any that are interested. And under the MIOSHA workplace guidance, everyone is required to establish workplace procedures. So like mandate masks, require employees to self-screen, and we're required to update our policies. So for the county, we have a policy called temporary requirements for protective safety measures. It talks about PPE, it talks about masks, and we have that also on our website. Employers are required to create workplace procedures for cleaning and for what we do when there's an employee who is symptomatic or test positive. We're required to train employees on new policies and procedures. And this is something that we are finding the continual need to remind employees on, and specifically around the self-screening and the importance of deciding if you have symptoms before coming to work. So it is not okay to come to the office and then take your temperature, because at that time you've potentially already spread the virus if you have it. And then finally, to follow requirements specific to different industries. So within that set of rules that MIOSHA put out, there are requirements, for example, for construction industry, for different industries. And this is, you can find it easily on the state's website. I also want to mention that there has been new state legislation enacted just recently to protect employers from liability claims from employees who may have been exposed to COVID-19 within the workplace. So as long as we are in compliance with these MIOSHA rules and other federal, state, and public health guidance, we're protected from claims that are costly. They add court costs, they add cost of defense to employers. So those are House Bills 6030, 6031, 6032. Those three are tie-barred together. They also protect employees from being terminated because of their COVID-19 illness. But if employees are willful about disregarding our workplace safety policies and procedures, then employers do have the right to take appropriate disciplinary actions. So in summary, for my focus today, the workplace spread of COVID is definitely harmful for our economy and our reopening plans. How many of you have showed up at a business or a restaurant or a store and found the sign on the door that they're closed because they don't have enough employees to operate successfully? And as important, making sure that we as employers are doing our best to put in place these policies and procedures and enforce them goes a long way to reduce the stress and anxiety levels that all of our employees are experiencing as they are trying to do their jobs. So that's it for this slide. And then I'll briefly just touch on election, the upcoming election. So we can go to the next slide. And I will start by saying I am so happy that we're almost at election day. And I'll be even happier when it's over. There are a lot of unknowns in leadership. I always say leadership matters. And especially this year for county government, all of our elected officials are facing opposition next Tuesday. So if you're going to the polls next Tuesday, there are some important things. I guess I'll summarize, because there's a lot of information on the state's website, on the county's website. Our local clerks have been working tirelessly. I know they have a historic level of stress right now, but really the bottom line is just make sure that you're prepared when you get there. This will potentially be what looks like a large gathering. It will be difficult to socially distance, but if you're prepared, and voters are strongly encouraged to wear a mask. It is not mandated if you are voting in person to wear a mask. It is strongly encouraged, but all of the election workers must wear the masks. So that should give those that are showing up in person some level of comfort. If you do your part, the personnel there also will be prepared. Also, to avoid conflict, don't talk to people that are standing outside who are trying to influence voters. And then we'll go to the next slide. The next slide just emphasizes that it is still not too late to vote by mail, but it should not, actually it won't be by mail right now. At this point, we're at the point where if you want to vote absentee before Tuesday, you can still go to your clerk's office, get a ballot, and then you personally and physically will need to return it to their drop box to the clerk's office before the deadline, which is 4 p.m. the day before the election. And so I think our message is just, we really believe in the freedom that we all have to exercise our right to vote, whether it's in person or whether it's using the absentee ballot. There's a lot of guidance out there about how to do it safely, and we hope things go well, and we'll take bets on how long we'll be waiting to get the results, but I'll be happy that that's over and we can move on to the next big event. And that's it for me today. Thank you.
Okay, thank you very much, Kelly, for your report. Very appreciated. Our next speaker, Ted Deering, who is the Battle Creek Assistant City Manager, will be covering two topics: Halloween, of course, coming up very soon, and the homeless shelter situation. Ted?
Thank you, Dirk. I appreciate it. Actually, I think what we're hearing or seeing is that it's going to actually be a nice day on Saturday. And we know as a result of that folks are going to be very anxious to want to participate in traditional Halloween activities. And we ask that if you do make the decision to do that you do so please with an extra amount of caution this year, as we continue to see, as you have heard on this report today, a tremendous spike in cases. So folks have got to be careful out there if they're out, particularly trick-or-treating. Depending on your jurisdiction, there are some different official rules in place governing Halloween activities. And as you can see here, there's a very helpful graphic included on this particular slide for various government entities in the county. Be sure and check out what the rules are in the place of your particular location before heading out. And I think most folks know too that the CDC has issued some guidelines for Halloween, and that it should be noted again that traditional trick-or-treating has been identified as high risk. So if you're out there trick-or-treating, again, please be sure to social distance, avoid congregating at the house or at the curb, for example, move in one direction, and be sure to wear a suitable mask. So like the old, Frankenstein mask we used to get at the old 5 and dime, and I realize by saying that I'm dating myself, but that's not going to be adequate. You need to wear a proper face mask. Make sure that all the kids are wearing a proper face mask as well. And if you are giving out candy, please do so outside. And we've been fortunate, our PIOs have put together a great video guide for Halloween this year. Be sure and check it out on YouTube. There's a link here on the slide. Next slide, please. So we have talked quite a bit in these meetings about the efforts of a local group of stakeholders to address the needs of our most vulnerable population, particularly the homeless during this pandemic. And the new homeless shelter operations are up and operational at 209 East Michigan. And as you can see, meals are being provided, as well as access to laundry and showers, with more capacity for showers coming soon. You can see the daytime capacity at the new shelter is 38 and the overnight capacity is 32. The new location hosted the Calhoun County Connects recently, which was more formally known and more commonly referred to as the Homeless Health Fair. And they distributed a care pack for shelter guests and families in our community. I did connect with Share Center Executive Director Robert Elkert just before this meeting, and he indicated that there are still plenty of packs available for distribution for qualified individuals, and you can pick those up at 209 East Michigan. So Robert gave a very enthusiastic report on the services at the most recent Joint Operations Command briefing. Be sure to reach out to Robert or reach out to Dan Jones at the Haven, or really any of the members of the newly created Homeless Shelter Task Force if you have any questions. Thank you.
Thank you very much, Ted, for that. Appreciate your report. Coming up next is going to be Senator Dr. John Bison. He's going to discuss unemployment. Senator Bison.
Hi, can everyone hear me now? I hope. I'm Karen Todd. I'm here on behalf of Senator Bison today. He is in a meeting today, or right this hour, rather. I just have a few things I wanted to talk about. Customers, claimants, UIA claimants, unemployment claimants can now schedule an appointment online up to 1 week in advance for the following issues. Now, this is for people who have been having problems, difficulties getting through to the UIA system to talk to someone live. The UIA rolled out this appointment system late last week. So they can schedule appointments for the following issues if they filed under the wrong Social Security number, if their claim is inactive, if they're unable to identify, to certify for all their weeks needed, if they need to file a claim, but one is already filed in their name, or if they don't have a link to the MyWAM dashboard to file a claim. So these are the issues that people will be able to make appointments for. We're hoping in the future that people will be able to make appointments for other necessary issues that they're dealing with. Right now, we're seeing that most people who are still waiting on benefits, weeks of benefits, are in a managerial review process right now. And it's moving at a snail's pace, moving slowly. And the UIA has said that they're trying to get through those as quickly as they can. So it's still a kind of a waiting game, but we've made small progress with being able to make these appointments. So some exciting news, the governor's office announced an exciting grant opportunity for teachers and support staff yesterday. And so if you could pass this along to teachers that you know, eligible Michigan teachers and support staff who worked additional time and incurred additional costs during the 2019-2020 school year due to COVID-19 pandemic can receive a grant through 2 new grant programs. Eligible teachers can receive up to $500 and eligible support staff can receive up to $250. That would come from the State Treasurer's Office around February 2021. For more information about that, and Jessica, I should have given this to you to put up on the slide. You can go to michigan.gov/TSSC19 grants. I'll try to put that in the chat box before we're finished here today. Just a couple more things regarding the Michigan Senate. They passed a few bills that I wanted to point out. This actually happened back on October 14th. The legislature is on recess right now. And I believe the House passed these same bills on the same day, and they were signed into law by the governor on October 20th. They are Senate Bill 886, which extends some of Michigan's COVID-19 unemployment expansions through December 31st. Vehicle registration extends the validity of driver's license, state identification cards, and certain vehicle registrations to December 11th, and that replaces the executive order, which extended them to September 30th. And also a nursing home bill, Senate Bill 1094. This addresses a specific provision which allowed for COVID-19 patients to enter nursing homes capable of housing them in dedicated and isolated containment wings. And then Kelly spoke earlier about the liability package of bills that passed and that were signed by the governor. So I think that's all that I have. If anyone has any questions, please feel free to contact the senator's office and we'll try and get you what you need. Thank you.
Karen, thank you for your report. Appreciate that very much. We are moving on to comments from elected officials. We'll go back to Karen. Any additional things from Senator Bison's office that you'd like to share, or did you cover it, Karen?
I think I covered everything. We're all set. We have had some reported COVID cases in the Senate building. They've been on our floor, the 3rd floor, as well as some of the other floors, but I think everyone's doing well. Everyone's healthy in our office. And so we're hoping to keep it that way. That's all. Thanks.
Yes, we all hope for that. Thank you, Karen Todd, very much for your reports today. Moving on to Representative Jim Hatzma. Jim, are you there?
I am. Thank you. Karen Todd covered much of this for Dr. Bison's office. I'll clarify that in context of some of the backup, it's associated with getting a last clear chance check on some of the payments. Some of the payments to some of the claimants are significant, and to ensure that there's not fraud, there's been an effort to ensure that there's a second line of checking. In addition to communicating with Dr. Bison's office and Karen, I'd recommend additionally that people communicate with Representative Matt Hall's office or my office. We too can help. I've been able to interact with a friend in the UIA who's been helpful in getting some of these backed up retroactive unemployment compensation payments cleared more quickly. So I recommend that you continue to communicate with Dr. Bison's office, with Matt Hall's office, and with my office in relation to any kind of unemployment compensation issues. I'll put my office phone and my cell phone in chat for those who would wish to refer someone directly to me. Thank you.
Representative Hatzma, thank you very much for your report. Representative Hall, are you with us today? Okay, moving on down to county elected officials. Are there any county elected officials that would like to speak at this time? Okay, hearing none, we'll move on to tribal elected officials. And moving down to city elected officials, if there's any city elected officials that would like to speak. Moving on to township elected officials. And finally, village elected officials. Anyone else with any last minute thoughts? Move on to the next slide, please. Okay, with that said, our next live JIC will be to be announced. There will not be a JIC on November 11th due to the fact that that is Veterans Day. And we can go to the next slide, please. Best sources of information coming up here. There's the top 4. And next slide, please. Big thank you for all the help today, cooperation on chat, and everything else that you do behind the scenes on this report today, this briefing. Jessica Vanderkolk from the City of Battle Creek, Communications Manager. Thank you so much. And with all of that said, I will wish everyone a safe week, and please take care. Have a great day.